Emily Knight is passionate about her work. As a doctoral student, she works as a researcher at the Lawson Health Research Institute and Western University in London, Ontario. She's undertaking a study to determine how technology can be used to improve the management and prevention of chronic diseases. This promising research thesis has earned Emily the first award granted by the Small Health Organizations Partnership Program, which supports physiotherapy-related research and focuses on the mobility of older Canadians. This grant is for $35,000 a year for 3 years, and the funding collaboratively comes from the Physiotherapy Foundation of Canada, the Canadian Physiotherapy Association, and the Canadian Institute of Health Research. Emily's interest in physiotherapy spans back several years. Emily, if you can just explain to us how you first came into contact with physiotherapy.
Growing up with sports and arts, I often used physiotherapy services myself with various sports-related injuries. And then during my undergraduate degree, I worked as a physiotherapy aide in a sports physiotherapy center. And now in graduate school, I'm training to become a physiotherapist myself. And
which of these experiences do you think drove you into this wonderful field of physiotherapy?
I think my passion was really developed during rehabilitation from knee surgery for an injury that I had while I was dancing. So during that time, I spent many hours in a physiotherapy center, both receiving physiotherapy practices and observing the practices going on around me.
And there's your experience with physiotherapy. So what do you think drove you to look at research in physiotherapy specifically?
Well, my undergraduate degree was in kinesiology, and I was fortunate when I finished that degree program to find work as a kinesiologist in a research center. So that was really my first hands-on experience with research, and I was surprised by how much I enjoyed it because I thought I'd always wanted to be a clinician. So I was really excited when I found this unique program that Western University offers, where you get physiotherapy and research training in a single degree program.
This combined program is quite exciting. What specifically are your main interests for research?
At the base level, I'm just interested in getting people moving. So how do we get people leading healthy, active lifestyles at all ages and abilities?
Can you, Emily, can you tell us more about the research project that was awarded you the grant from Physiotherapy Foundation, Canadian Physiotherapy Association, and CIHR?
This research program is investigating how we can use self-directed health technology, so things like smartphones that exist around us, to help engage people in their own health and help them manage their risk for cardiovascular disease. So we work with older adults in London and southwestern Ontario, and we work with physical activity prescription and these self-directed technologies to help reduce cardiovascular risk.
And where are you finding these patients that you're using for your studies?
We have excellent volunteers from the community, and we work with family health teams in the local area here in London.
Emily, why do you feel that it's important to conduct research in the field of physiotherapy?
Well, research is really the best way to answer the identified needs in our community. So it's a systematic approach to getting the answers that you need to ensure that your practice is evolving and representing the needs that your patient population require.
You've mentioned that you recruited some of your patients through local healthcare organizations, family healthcare teams, office-based physiotherapists. How would you suggest that physiotherapists in the community get involved in research?
There are many ways to be involved in research, so it doesn't necessarily mean that you have to conduct a study yourself. Providing access to your patients in your clinic is a great way to help, especially graduate students, get their research going. Offering expert opinions, a lot of the time when we're designing research programs, we need to consult with the experts in the field to find out what questions they really need to have answered. So offering your opinions and providing access are great ways to be involved in research.
In terms of how this grant from the Physiotherapy Foundation of Canada, which is a charitable organization providing base research funding for physiotherapists, in terms of how this grant has impacted your ability to do what you want to do, how important is this grant to physiotherapy in Canada?
I think this grant is really important. At this level of starting out in a research career, so at the doctoral level, this means that I have the funding to go forward and make sure that my research is well suited to physiotherapy. So instead of having to make it a hybrid and suit it with other already identified research priorities in Canada, making physiotherapy a research priority is really exciting as a new clinician and new researcher.
Well, Emily, thank you for your dedication to research in the field of physiotherapy, and you're helping to ensure the practice of physiotherapy continues to evolve and will continue to help Canadians move better, with physiotherapy. Thank you very much.
Thank you.